My name is Minnie Raphael, and this is Physical Therapy After Hip Fracture with Cervical Intervention. Welcome to this presentation on hip fracture rehab and recovery, where we'll be discussing hip fracture recovery and what to expect during physical therapy. If your loved one has experienced a hip fracture, understanding the rehabilitation process can set realistic goals for recovery. We will talk about the overview of the hip fracture, importance of physical therapy, phases of recovery, and tips for successful rehabilitation. Let's break it down. Hip fractures are defined as a break or multiple breakages in the bone of the proximal femur between the femoral head and 5 cm distal to the lesser trochanter. Hip fractures are the most commonly caused by a fall, and it is the most prevalent traumatic injury among older adults, although hip fractures happen to adults and younger individuals as well. The most common surgical management for hip fracture is open reduction internal fixation, where the surgeon uses stainless steel or titanium-based screws and rods to stabilize and immobilize the fracture for bone healing. Physical therapy plays a critical role in hip fracture recovery by restoring mobility, reducing pain, and improving strength. Studies show that early mobilization, usually within 24 to 48 hours post-surgery, leads to better outcomes and prevents complications like blood clots and muscle weakness, according to Lee et al. And McDonough et al. Physical therapy is customized based on factors such as age, pre-injury function, and overall health status. Now let's go over the various phases of physical therapy after a hip fracture. The first is the acute phase, which is a hospital stay from days 1 to 5. This includes training for leg weight bearing based on surgeon's recommendations. Another intervention is the bed mobility, sit to stand, and transverse training with safety emphasis. Of course, there's gait training with the assistive device, usually using a walker as initiated by PT for safety. Another intervention is the gentle range of motion exercises, whether active or passive or active assisted, as the individual is able to tolerate or perform. The risk for falls increases as the individual begins to regain mobility. With weakness from the fracture and surgery, along with pain, it is very vital for the individual to utilize various members of the rehab team and ask for assistance as needed. The next is the post-acute, which usually happens either in a skilled nursing facility, a short-term rehab facility, inpatient rehab facility, or home health, from about weeks 1 to 6. As the pain decreases and the mobility gradually increases, the following PT interventions are provided. Strengthening exercises, specifically like quadriceps and the glutes musculature, which focus on strengthening on specific weak muscles and dynamically elongating tight, soft tissues affected by the fracture and the surgical incisions. Another focus is balance training to prevent falls, advancing balance activities to progress the individual to decrease dependence on the use of walker or any assistive device eventually. Of course, gait training will improve the walking mechanics by improving and eliminating gait deviations or impairments associated with pain protection and the weakness of the affected hip muscle area. The goal eventually is to normalize the walking pattern with the less use of assistive device or less dependence while continuing to ensure the patient's safety. Keep in mind that all these durations of recovery varies from individual to individual, and it's a case to case in every phase of the rehabilitation. The last phase is the outpatient or the long-term recovery, which usually happens around week 6 or onwards. At this final stage of the journey to full recovery, the individual has safely transitioned to home and is now in need of high-level PT interventions to return to prior level of activities, return to sports or any advanced mobility before the injury. There continues to be a focus on normal movements and fall prevention. The interventions are similar to the earlier phase with advanced strength training, endurance activities, incorporating stationary bike, treadmill walking, progressing to jogging or brisk walking, functional exercise for daily activities, including getting up from the floor safely and independently, and also transitioning to community-based exercise groups or physical activities, return to sports and other prior activities that the individual used to do for a functional maintenance program. Studies by Dyer et al. And Tobias et al. Highlight that structured physical therapy as well as social support and peer programs significantly improve recovery and reduce the risk for future fractures. Here are some key tips to ensure the smooth recovery process. First, follow your physical therapist's guidance and prescribed exercises. Also, use assistive devices as needed to avoid falls when recommended. Stay consistent with rehabilitation activities and keep in mind that rehabilitation takes time and effort. Another one is maintain good nutrition for bone health and healing. And lastly, stay engaged. Socially, mentally, and physically active individuals recover faster. By staying committed to therapy and maintaining a positive mindset, patients can regain independence and return to their daily activities sooner and safely. That's it for today's episode. If you found this helpful, share it with someone who might benefit from it. Stay strong, active, and take charge of your recovery. Until next time. And here are the references for this presentation. Thank you so much for your time.